Good morning, everyone. Welcome
Good
to the
morning.
welcome to the HPI webinar series. My name is Dr. Adityanji, and I am the founding president of HPI. This is our HPI's mantra, Sharira Madhyam Khalu Dharma Sadhanam, not only for our patients, but also for ourselves also. So let's review what is HPI. We are a faith-based charity by physicians of dharmic origin to serve entire humanity. We are a registered non-profit in United States, and we focus on issues of dharmic importance in practice of medicine, things like Vasudhaiva Kutumbakam, Nar Seva, Narayan Seva, and we believe in concept of serving the entire humanity. The concept of HPI was that there are a lot of faith-based medical charities that provide humanitarian assistance, disaster relief. And I'll give you examples. Red Cross, Doctors Without Borders. These are all faith-based charity, and there are faith-based charities with Jewish medical doctors and, Muslim doctors, but there were no Hindu medical charities. That's why we started it. And it has its value. So we have a board of directors, an international advisory board of eminent physicians, and then we have an executive committee. And today I'm very happy to say that Dr. Siva Kumaran Raman, he is our honorary director of community projects. He is managing this. We are looking for young physicians who want to serve on the executive committee so they can help us take care of our work. Mainly, what we strive to do is community service projects worldwide, develop rapid response medical teams, provide humanitarian assistance and disaster relief, promote prevention, research, and treatment of common illnesses in the community, assist in availability of clean water to the masses, and prevent environmental degradation. Our membership is free. You can go on our website and fill up a Google Doc. There's no charges for that, whether it is physicians, surgeons, uh, allied professionals, or community volunteers. There's a community seva project form. If you're doing a community seva project, share that with us and we will make it, a project of HPI. You still retain the control of your project. And then we have a distinguished Hindu physician lecture series where we invite anyone, any Hindu physician. And when I say Hindu physician, it could be Sanatani, Buddhist, Jain, Sikh, all from the Sanatan Dharmic traditions. So we want to feature them if people are excelling in their field. Today's lecture is going to be given by a very young and dynamic physician, Dr. Dipali Desai. She will be speaking on new pathways to control anxiety and sleep. A little bit about Dr. Desai. Those of you who saw this flyer, this was a flyer when we made the announcement. Dr. Desai is a family medicine practitioner at University Hospital Medical Practice at Southwest General Hospital in Cleveland, Ohio. She's also practicing and training in integrative psychiatry. She is fellow in lifestyle medicine. She is associate professor at Baldwin Wallace University with the PA program training the PAs. She is a member of Academic Consortium for Integrated Medicine and Health. She received Women of Distinction Honor in 2024, and she has been listed or given America's Best Doctor Award in 2025. I'm very pleased to have known Dr. Desai because she encouraged me to attend Art of Living, Sky Breathing seminars. So I'm really grateful to her. A little bit about our focus. Our focus is on Seva, and I'll just share a couple of, we worked with Cleveland Food Bank, sponsoring around 12,000 meals with Cleveland Food Bank. And then more recently, we worked with a cancer charity called the Gathering Place in Westlake, Ohio, and you see Dr. Desai's picture here. She's sitting there. So we helped with this particular charity that deals with rehabilitation of cancer survivors, women and children. So women who after chemotherapy lose their hair, it is very important, and the charity provides them free kind of wigs.
મમ્મી પ્લીઝ અહીંયા બેહી જા ને અવાજ નહીં કર.
If you are based in United States, we encourage you to donate and support HPI. You can go on our website. You can pay through PayPal or Zelle, or you can mail a check to our PO box address. And of course, that is Swasti Vachan. So I will stop sharing my screen now and just give it to Dr. Desai, the entire platform, and she will be starting with her lecture on alternative pathways to control anxiety and improve sleep. Dr. Desai, kindly unmute yourself.
Thank you, Dr. Adityan. Really grateful to be on HPI platform. And this is a wonderful opportunity that you gave me. Thank you. Thank you so much for this opportunity. I would start sharing my screen and start with the presentation. So today we all gonna discuss about some new pathways to control anxiety and improve sleep. I'm a family physician and a practicing physician for more than 10 or 15 years. During my practice, I realized that, our introduction to psychiatry was very little. So it was 1 or 2 months of rotation in my entire training. So I decided when I actually came to the practice that I want to learn more about how to treat a mental health disorder, and ended up doing fellowship in integrative psychiatry and nutritional psychiatry so that I can help my patient. So these are the learning objective for today's talk. We're going to talk about some definitions, some common symptoms. We'll go with the conventional approach as well as the integrative modality. So some small facts, what's going on in the mental health world right now. According to WHO, anxiety disorder are most common form of mental health disorder in the world. And before pandemic, around 19.1% of US population were suffering from anxiety. But after pandemic, this data has increased almost 1.5 times. If you see, it is 32.3% patients suffer from anxiety as of 2023. And the last data I saw was 47% after 2024. And prevalence of insomnia was about 22%, and now it has been increased to about 30%. So we are talking about 1 in 3 is suffering from either anxiety or stress-related disorder or insomnia. And small definition, we all know that, many people worry about things. Some people worry about health, some people worry about money, some people worry about family or relationship. But what happened with the anxiety disorder is, they have intense or excess or persistent worry and fear about the everyday life situation. And these symptoms sometimes can lead to affecting their daily activities, such as it can affect the job performances, sometimes schoolwork, sometimes relationship. And there are several type of anxiety disorder. Dr. Adityan knows much detail. I'm not going into much detail about this, but how to diagnose anxiety and treat it, I'm gonna go over with you. So common symptoms, most people know about how the anxiety manifests. You have seen people who feel restless or sometimes on edge. Sometimes they are irritable. One of the less common but more manifested symptom could be, body ache, muscle pain, headache, or unexplained pain. I have seen in my practice some people have constant difficulty controlling their worries. Sometimes it leads to, like, excess anxiety leads to sleep problem. It can also cause palpitation or sweating or shakiness or jerking. In many panic disorders, or when the GI or the gut is manifesting anxiety, you can see as nausea, vomiting, diarrhea, sometimes chest pain or shortness of breath. Now, why we are talking so much about sleep and why the sleep is so much of importance? Because during the wakeful state, whatever we eat, whatever circumstances we go through, the work, the stress and everything, when we sleep, sleep has tendency to reverse all the damages from wakefulness state. So it reverses the oxidative stress, it repletes the energy stores. Our body and brain cools down when we have deep sleep. And in children, you have probably noticed that, it stimulates the brain development. Children sleeps a lot more than an adult sleep because their brain is developing. It also regulate ion channel. It also help with enhancing memory, enhancing learning, and it optimize the regulation of the physiological function. And a lot of time, sleep loss can adversely affect the metabolic hormone. So there is increase in evening cortisol, which has been noticed in people who don't sleep well. Or because of the chronic lack of sleep, there is tendency that their body is not resting and their evening cortisol stays high. There is enhanced sympathetic activation, same, because body is not resting. It can alter the thyroid pathway. It can decrease your glucose intolerance. It can increase the ghrelin. Now, ghrelin is a peptide that brings hunger, and it decreases the leptin that usually, causes the satisfaction, or it's saturating it. Tell your body that, okay, I'm now saturated. I don't have to eat more. So a lot of time these endocrine changes happen because of lack of sleep, and it cause altered signaling of the hunger as well as appetite, and it may leads to weight gain or obesity. A lot of people who have difficulty losing weight, if you ask them more, they will tell you they have difficulty sleeping for a while. Symptoms which are associated with poor sleep, again, because your body is not resting, it can cause fatigue or weight gain or anxiety, chronic aches and pains, physical deconditioning, and sometimes sexual dysfunction. So, conventional approach, you all know better than me. Usually, we use SSRI or SNRI. These are the medication I listed. Sometimes it can cause, some GI side effect or weight gain, sometimes sexual dysfunction. TCA can be used, amitriptyline, nortriptyline. These are very well used for, treating this chronic insomnia and for good nighttime sleep. In the severe cases of anxiety, we sometimes use benzodiazepine. This approach is more used in a severely anxious patient or in acute anxiety or anxiety, especially in the hospital wards. Now, the other approach is cognitive behavioral therapy. Lot of time, people start with mild anxiety or moderate anxiety. And here, if you tell them to go for psychotherapy or cognitive behavioral therapy, there is a very good remission rate. It is up to 60 to 70%. You have seen remission rate in this. The only thing is, it's quite expensive and it is time consuming. So it takes time to see the effect, but it is one of the very good approach to take. Now, we are here to know about the integrative or the new pathways, how we can control anxiety and what are the other factors that affects the anxiety. So we are basically, trying to engage the body, mind, and spirit, and we will try to put some healthy lifestyle factor for the patient, and we'll try to pay focused attention on how to prevent or maintain good health and reduce anxiety. A lot of nutraceutical I'm going to discuss, and it's basically an holistic approach. So, some pathophysiology that we have chronically noticed in patient with anxiety or insomnia, and that's why I do certain lab testing. So here, a lot of time if your thyroid is upset, high thyroid or low thyroid, if you are deficient in iron, if you're deficient in B12 or vitamin D, that causes, chronic fatigue or chronic anxiety. So these are some labs that I usually do in most of my patients to rule out any organic cause. There are some special testing too if somebody is interested, checking their cortisol or the DHA or other hormone level. Sometimes we go with the food allergy test and microbiome test because, they say your gut is your second brain. So a lot of time patient with IBS or IBD who suffer from chronic anxiety, if there is, like a chronic gut inflammation is involved, I try to address their gut symptom and microbiome panel, and then after go ahead and treat the anxiety. So, some are the nutraceutical I'm going to go over with you is number one is inositol. It is a plant which is naturally occurring anti-anxiety tool. It's derived from plant cell phytin. I usually start with the low dose, 2 to 3 gram per day, and we put it in a 1 liter water bottle. And I tell my patient to sip it throughout the day. It calms down the anxiety. This has been used for a lot of PCOD patients because it reduced down that glucose intolerance too. Most common side effect, loose stool. L-theanine, like this is, a lot of people now know about the matcha tea. Matcha tea is we inherited from Japan, and this Japanese tea, usually the L-theanine is the extract of it, which enhances your GABA and it improves your sleep. It is well tolerated up to 400 milligram 3 times a day. Basically, what L-theanine does is it create a relaxed alertness. So if you look at the brain wave of a patient taking L-theanine, you'll see beta wave as well as alpha wave all together. And this is non-sedating. It keeps you awake and alert during the day. So it can be used for anxiety as well as sleep. GABA is also very well researched sleep aid, and it is very well tolerated up to 500 to 1000 milligram. If you look at, somebody who is long time not sleeping or suffering from chronic insomnia, those patients have tendency to get sick very easily too because that detoxification is not happening. In this patient, if you use GABA, it has a tendency to help with your IgA level, which helps with effective immune defense. And IgA, usually, it could be used within 1 hour of it administration. It causes relaxation and diminish anxiety. So I usually use for patient who need, immune boosting as well as calm down their stress and anxiety. The fourth one is, 5-HTP, which is precursor of serotonin, and tryptophan is precursor of 5-HTP. They both can be used along with SSRI. I usually don't use it by themselves, but it can be added on to SSRI to improve sleep. Now, a lot of patients who have trichotillomania, like constantly they're pulling out their hair or have a lot of skin condition and keep on scratching their skin or skin picking, or people who are alcoholic, which causes, a long-term anxiety because alcohol has tendency to um, calm down the GABA, but in the rebound usually cause more anxiety, and a lot of time it wash out your magnesium, so it causes lot of toxification around the liver. So N-acetyl cysteine is used for patient who are under trying to go for the alcohol remission because it enhances the liver glutathione, and these are the dosing. Now, chronic stress is the number one cause of anxiety and insomnia in today's world. So, our ancient Ayurvedic medicine says, which was 5,000 years ago, this has all been researched how stress affects our body. So a lot of Ayurvedic herb are adaptogen, and when we use it as adaptogen like ashwagandha or rhodiola, they have tendency to reduce your stress hormone called cortisol, and that's how it calms down your anxiety and help you sleep better. Now, some nutritional intervention, the just like, our body need good nutrition to stay healthy, our mind also need good nutrition to stay healthy. So eating a well-balanced diet, or a diet which is rich in whole grain, fruits, vegetables, or fish, which has high omega, helps controlling anxiety. I highly recommend drinking at least 3 liters of water daily, which flush out all the toxins. We talked about avoiding alcohol and coffee. A lot of time, in today's world, especially if you look at the teenager or college student, or people who work in go environment, they have tendency to skip meals. They will skip their breakfast, or they will skip their lunch, and what they do is they drink coffee throughout the day, or sometimes they have energy drink, or sometimes they just munch on the cookies and candies and ice cream. Now what happens is, they give you immediate pleasure, but when you have high caffeine or high sugar intake in your body, it causes a sharp increase in your glucose, and then sharp drop in your blood sugar level, and that causes make someone feel jittery, or more anxious or edgy. So in this case, just by telling them that, avoid the caffeine, or avoid the sugary drink or carbonated drink, will calm down anxiety. And when they try this more holistic approach of eating whole food, or having high protein breakfast, or avoiding late night meal, this calms down the anxiety. Now, there are a lot of micronutrient. As I talk about, there are a lot of organic reason. So magnesium and zinc is very well studied to calm down the anxiety. And I have listed some food resources that helps with improving anxiety. You can incorporate more green leafy vegetables, more nuts and seeds, which are high in magnesium and zinc. Food which is rich in B vitamin, like beans and lentils, or almonds or walnuts. Food which is rich in omega-3. American Academy of Psychiatry says that you should have at least 1,000 milligram of omega-3 in your diet on daily basis, because it enhances the neurotransmission by thinning down the cellular wall and improving the neurotransmission. So fatty fish, if you like fish, you can go with the salmon or sardine. A lot of time, if you just incorporate different seed like chia seed, flax seed, hemp seed, they are very high in omega-3. People take good, omega-3 capsules too, to calm down anxiety, and detoxify your body, or enhance that fluidity in your brain. Now, I have listed the micronutrient formula too, because, if you just go back 50 years ago or 100 years ago, our land used to be very fertile, and most produce were organic. There were not too much use of pesticide or insecticide or fertilizer, or gene modification at that time. But nowadays, in last 20 or 30 year, there is a lot of farming has changed, and because of the use of insecticide and pesticide, if you look at the level of vitamin and mineral in our soil, it has been significantly reduced down from what it was 50 years ago. So if you implement some essential nutrient in form of vitamin, mineral, and amino acid, I usually use daily essential nutrient. These has about 20 to 40 peer reviewed trial. You can look up on their website how it helps with different mental health condition. But basically this is like a good food, or a good nutrition that you're implementing along with your medication, or just take it as a nutrient on daily basis, which calms down anxiety, help you focus, improve energy and sleep. Food which are rich in antioxidant, They say to prevent heart disease, to prevent diabetes, try to have food which are rich in antioxidant. The same thing applies to your mental health too. If you eat food which are rich in antioxidant, it calms down that constant inflammation in the body, and it calms down the anxiety. So as we discussed, beans, fruits, berries, nuts, vegetables, and certain spices, there has been multiple research on turmeric or curcumin, how it is very high on antioxidant potential. And ginger is also very well studied, how it calms down the gut inflammation and calms down the anxiety. Now, a lot of cancer patients, they have insomnia as very frequent or very common problem, that they're so stressed out they just cannot sleep. So nutrition intervention does help, medication does help, but what helps along with this is cognitive behavioral therapy or mindfulness intervention. There has been multiple research on, impact of mindfulness-based stress reduction, how it improves sleep, mood, stress, and fatigue symptom in patient with cancer. There were, group mindfulness meditation. This study was done with around 63 cancer patients, and it has been noticed that, it enhances your sleep significantly and reduce the disturbance significantly. I also give some good resource like, mindfulness app. A lot of people, they say, oh, my mind goes so fast, I don't know how to calm it down or how to meditate. So now in today's world, there are a lot of apps which are available. Some, if you look at the number 2, Insight Timer, or number 3, Headspace, these are free app. You can just download it in your phone, and you can try to meditate or try to listen to some calming music to help you sleep. Now, Calm, the number 1 app that I listed, it used to be a paid app, but the good news is uh, now the Calm is covered by your HSA account. So if you have a health saving account, you can buy Calm app on your phone, the yearly subscription, and try to meditate with a lot of different sounds and music that are introduced in Calm. If you have never meditated and want to try the first time, I would probably start with Yoga Nidra or sleep meditation, which is very calming and very soothing. These are some online mindfulness courses also I have listed. If somebody want to go for these courses, they are available through UCLA health.org, soundstrue.com. And yoga, again, yoga is an ancient technique which is uh, our ancient rishis and ancient yogis used to practice for thousands of years, which has a tendency to calm down our vagal tone, calm down our anxiety. Now, one of the very well researched yogic breathing is sky breath meditation. This I was introduced with sky breath meditation during pandemic, and uh, it usually delivered through foundations like Art of Living. If you go on a website of Art of Living and look up the sky breath meditation research, there are more than 100 independent research studies on this breathing technique. Now, when you go with the Kundalini yoga style or cyclic rhythmic pattern of breath, it has tendency to bring your mind and body into relaxed as well as energized state. Now think about a situation, if you're angry or if you're edgy, how would you breathe? Yeah, you breathe fast, or your respiration become very shallow. Somebody who's deeply sad or upset, if you look at him or her, their breathing is shallow. They shy a lot like this. And if you're happy, you don't even realize how you're breathing, right? So just like, your emotion control your breath, when you control your breath, it has tendency to control your emotion. The breath is a link between your inner world of silence and outer world of activity, and it is a tangible, when you are it's like a string with a kite. The breath is the string, and your mind is a kite. Your mind has tendency to go around everywhere in the past, in the future, in the worries and everywhere. But when you control it with deep rhythmic breathing and control that string, you have very well control over your emotions. So they have training courses. Art of Living Foundation is right now active in more than 150 countries. They have training courses for veteran, police, healthcare professional, college student, school students. If you want to know about it, I listed the research link. You can look up all the research. I'm gonna go over briefly what are the research proven benefit of sky breath meditation. As I said, stress is the leading cause of anxiety in new era, and cortisol is one of the major stress hormone. So when you learn the sky breath technique, uh, you are able to reduce your stress hormone by 50 to 60%. It also helps with improving your well-being hormone called prolactin, and it increases mental focus, heighten awareness, and there has been multiple research how sky practitioner spent good time in deep restful stages of sleep, that is stage 3 and stage 4. You will see sharp delta wave on sky practitioner when you go with the EEG finding. And there is increased level of antioxidant enzyme as well as improve immunity in healthy individual. Last but not the least, in today's generation, if you want to start with basics, I would highly recommend daily aerobic exercise, especially in the morning or afternoon. Late evening, you can exercise, but sometimes it's too stimulating. But if you exercise in the morning or afternoon, again, it has tendency to calm down your cortisol and help you energize your body and energize your mind. When you're trying to sleep, keep the room dark and cold as much as possible. A lot of our teenager and young student has tendency to use their phone, iPad, laptop, TV. I would avoid all the bright lights at night, especially a couple of hours before sleep. Do not eat heavy meal, especially after 6 or 7. That helps with digestion and improving sleep. Your mind is not engaged in digestion. It is more in the relaxation phase. Avoiding coffee, alcohol, we talked about it. And regular sleep routine also helps improving sleep. High functioning professional who are almost or every day in front of computers or laptop because of their work, and there is chronic screen exposure, if they use blue light blocking glasses, that also helps them sleep because it helps with improving their melatonin. So this is it. Feel free to ask any question. I'm open to all the questions.
Thank
Dr. Desai,
you.
there were some comments and questions in the chat panel.
Yeah, I will try stop.
Okay, I will read the questions for you, Dr. Desai, but let me thank you for very comprehensive presentation, excellent presentation, and I am actually deeply impressed from family medicine to integrative psychiatry. You have traversed a long distance. So let me read the questions. Are you aware of integrative health symposium taking place in New York City from February 19, 2026? This is 21st year of this particular symposium, and if anyone is attending, the person who has put this message can share the code, complimentary code. Dr. Desai, did you know about this? This is from Rita Kashi Bathija.
Yeah, there has been actually multiple integrative conferences happening throughout the United States. The one in New York, yes, it's a good one. There is one more coming up in April, which is through the academic consortium through integrative medicine, and this is happening in Salt Lake City, Utah. But yes, most of the integrative medicine conference, you can pick and choose one that which is nearby you or which you can travel and address. There is a lot of useful information in most conferences.
So I will request Dr. Rita Bhattija to share the complimentary code in the chat function. So if anyone wants to attend that, that'll be fine. Again, Dr. Bhattija is also talking about an API, optimal nutrition symposium, and has given some details in the chat function so people can refer to that. This is just informational rather than question. And then there's a question from Dr. Sasi Veloli. Is there any issue with taking these supplements together at the same time? Any contraindications, any adverse effects to look for?
So the nutraceutical that I discuss, the inositol is actually very calming. The most common side effect is, you might notice loose stool, sometimes diarrhea. So that's why we start with the lowest possible dose, and then we increases gradually, like weekly basis. The L-theanine, I have not noticed any side effect. I have used it in multiple patients and never heard of any side effect. N-acetylcysteine sometimes, because it activates your glutathione, you might notice maybe upset stomach or nausea. So my recommendation is you start with the lowest possible dose and then gradually increase. Ashwagandha has been studied for thousands of years, and a lot of people use it with technically no side effect. You will see enhance or improvement in your energy level, your sleep, your overall well-being.
So Dr. Bhattija is going to share the complimentary code in the chat function. People can refer to that. I must say that I have so many very, very positive comments about this presentation, Dr. Desai. People are really, really appreciating. I have a comment from Dr. Rajan Seni. I will also recommend testing of obstructive sleep apnea. Will you agree with that, Dr. Desai?
Yes, yes. Obstructive sleep apnea can lead to, a lot of time non-restful sleep, which triggers anxiety and depression, and can lead to chronic fatigue. So yes, you do test for obstructive sleep apnea too, and it is one of the organic cause of, untreated anxiety or treatment-resistant anxiety.
So others are just, appreciative comments and information about these other symposia and things like that. If there are any other last minute question, I have our member of board of directors, Dr. Rakesh Sharma, who is going to be asking a question or making a comment. Dr. Sharma, please.
Thank you. Excellent presentation, Dr. Desai. I just have one thing to add. You did mention avoid alcohol and caffeine. I just want to add that caffeine up to 400 milligrams a day is okay. Anxiety only comes when you take more than 400 milligrams a day. So if you drink 1 or 2 cups of coffee a day, that's actually very beneficial for other medical reasons. It decreases your MI, coronary arterial disease, CA prostate, and CA colon. So I would encourage people who drink coffee to continue drinking 1 to 2 cups a day.
Yes, that's true. You can have 1 or 2 cups of coffee a day, but coffee in the evening, or there are people who avoid meals and they survive on coffee throughout the day. That's more harmful.
Yeah, in fact, last year a new study came out that people who drink 1 cup of coffee in the morning, means at breakfast, have 30% less incidence of MI.
Good
Dr.
to know.
Adityanji, may I share something in reference to coffee, as Dr. Sharma mentioned, and
Okay, go
Dr.
ahead,
Desai?
please.
Okay, Dr. Desai, I believe if I heard correctly, you mentioned 400 milligram of caffeine, either you or Dr. Sharma. One
Dr.
I
Sharma
did.
coffee,
mentioned that.
one coffee, 1 cup of coffee is 80 milligram. 400 milligram is a lot. And I agree with Dr. Sharma that also the consumption of coffee, it prevents diabetes. I know there are studies done, and I will share that with you. And I am actually not a physician, but I am the integrative and functional medicine registered dietitian, nutritionist in private practice from Long Island, New York. And Dr. Naveen Mehta shared his information, and I'm connected, very well connected with all the practitioners at the Cleveland Clinic and everywhere, and highly encourage this API's resource. It is a plus, there is no cost involved to that. So this resource should be shared with our community.
Thank you very much indeed, Rita ji.
You're welcome.
And I'm going to take it from here. What Dr. Sharma said is what is medically safe in an average adult male as per FDA regulations, 400 milligram of caffeine per day, 80 milligram in a cup of coffee, that gives up to 4 cups of coffee that you can have safely. As a practicing psychiatrist, I can share this experience with people. Our young folk are actually drinking these monster and energy drinks and all that sort of thing. And each can has at least 200 milligram, if not more, of caffeine in it. And if these kids are consuming 2 or 3 cans a day, along with their usual intake of soda and coffee per se, uh, it becomes an overdose situation. It is not hypothetical. I see it all the time. There are kids who are actually ordering caffeine tablets from Canada and Hims and whatever. So just be aware that it's not just one source. You are getting your caffeine from multiple sources without realizing. And lastly, yes, caffeine has some beneficial effects. That is perfectly fine. And we would like to utilize those beneficial health effects. But there are beneficial effects of water, but we know what happens when there's overdose of water. Even overdose of water can also kill you. I, as a practicing psychiatrist, have seen patients developing psychosis because of excessive caffeine intake. So you have to take a much more comprehensive view about caffeine. Yes, it can be restorative, it can improve cognition, it has health benefit effects, but like any other thing, overdose of caffeine is problematical psychiatrically, does not cause just uh, anxiety, but other problems also. There are some more questions, so let me go into those questions. Uh, I think Rita ji has put some information there. Uh, there is a question, when are we going to do the next session again? Uh, there is, okay. So ultimately, we would like, people to benefit from all these resources, whether they are from API or from Dr. Naveen Mehta or Rita ji. Please refer to this chat and you can copy down from that. I will encourage all of you to go to HPI website, which is www.hinduphysiciansinternational.com. So you can get in touch with us. I put my email address there. People can email me, and then I can share my WhatsApp number to people. I have a question here. When are we having the next session? So I might as well make an announcement. Our next session would be on February 22nd. That is a Sunday, 10 a.m. Eastern Standard Time. Dr. Rahul Sharma will be giving a lecture on structural heart diseases, management, and lifestyle intervention. So every 2 weeks we are uh, coming out here. For these kind of lectures. I have a comment here from Dr. Pankaj Parekh, who is a cardiologist. He says that there's no definite benefit of coffee for CAD, as far as I know, as a cardiologist. Actually may aggravate tachyarrhythmias and peptic ulcer disease. So again, yes, coffee has some beneficial effects, but they can be problematical effects. The Dr. Sasi Valoli, you want to ask a question? Please go ahead and ask a question.
Yes. Last question. This is actually Shashi's wife, Dr. Savita. I'm an internist and sleep specialist. I have a question on the gut microbiome testing that she mentioned. Is there any test that you would recommend? I have several questions, but I guess I'll wait for the next session. So that was one. And secondly, it's like, how do you get, is there any reliable place to get supplements? Every time you hear about Ayurvedic supplements, it's about liver damage. That's what's amplified in the media, at least. So any place that she would recommend to get the ashwagandha from, for instance?
Dr. Desai, kindly unmute yourself. You're muted.
Yeah, Rita already shared, and I use usually the full script.
Okay.
Fullscript.com has most major brand of supplements that includes, lot of Ayurvedic herb, natural nutraceuticals, my vitamin, minerals, as well as a lot of Chinese herb. And these all supplements are tested for purity, potency, and integrity.
Oh,
So
Mhm.
yeah, go with fullscript.com.
Thank you so much.
Dr. Desai, if I may mention about the full script, that for the professionals, those who have the license, it is at cost, which is at almost 50% off, and they can offer to their patients up to 35% off. And there is somebody mentioned about the microbiome testing. There is a microbiome lab in Megasport. They also do the testing. There are cell novaes and all. There are substress has come also, besides the peptides and all. So there is a lot to learn in this field, and I'm so glad you did a fantastic job covering everything systematically, and I'm very proud of you.
Uh, there is a question from Dr. Rakesh Sharma. Dr. Rakesh Sharma, kindly unmute yourself. You're muted.
So
Yeah.
I had mentioned that a study came out in 2025. If you drink a cup of coffee in the morning, your chances of acute MI episodes go down by 30%. So Dr. Parikh said there's no benefit. Just for the benefit of everyone, this study was published in 2025 in European Journal, and it's from Tulane University.
Medical meeting.
And it's in European Heart Journal,
Oh,
which
sorry.
shows that if you drink one
Almost
cup
done.
of coffee a morning, it's
Oh,
associated with
okay.
31%
Oh, okay.
lower
Arre,
risk of
okay.
dying from coronary arterial disease.
Okay. Dr. Veloli, kindly mute yourself because there is some interference from your side. Thank you, Dr. Sharma, bringing that to light. So there is a request to share Dr. Desai's slide set. It's an intellectual property, but if Dr. Desai is agreeable, I will share this slide set with the HPI, group. Uh, if people can send me an email, I put my email there, address. Those who want the slide set, I will be able to send it to them if Dr. Desai gives her kind permission. So that is no problem from our side. Dr.
Yeah, there
Desai?
is no problem from my side too. Yeah.
So,
Yeah, if I may just put in a word edgeways, there is a link to a deep sleep and anxiety relief workshop in case anybody is interested happening in the end of February. Should I share the link in the
yes,
chat?
please share the link.
Yeah,
Please put in the
sure.
chat room.
Yeah.
Now,